Did you know that older adults can have COVID-19 and have different symptoms than younger adults? Do you know how to monitor your parents or yourself if you're over the age of 60 for the signs and symptoms of COVID-19? By the end of this video, you will understand the differences you may see in older adults and how to prevent this new disease. By subscribing to my channel and hitting that little bell, you'll be notified every Monday when I post a new video that's designed to help aging parents and their adult children work together to navigate this sometimes confusing healthcare system. Good morning, health-minded people. I'm Dr. Snow, and as a pharmacist, I'm getting many questions from my patients about COVID-19. You can find all kinds of information about this new disease on the internet, on the television, and in the newspapers. In a recent report about COVID-19, aren't they all recent? A study showed that older adults may have different symptoms than younger adults at the onset of the COVID-19 virus. As we age, what would be considered a slight fever in a young adult or child might be a high fever in an older adult. Fever in an adult is typically considered 100.4 or higher. And approximately 80% of patients with COVID-19 do have a fever of over 100.4. However, it has been observed that in people over the age of 60, only 30% of them with COVID-19 have a fever of over 100. So now the Infectious Disease Society of America is recommending that anyone over the age of 60 be considered to have a fever if they have one reading over 100 degrees Fahrenheit orally, 99 degrees twice, or for those adults who know that their normal body temperature is less than the regular 98.6 that most people have. A fever would be defined as anything over 2 degrees above this baseline. So if you have other symptoms of the COVID-19 infection, but don't think you probably have it because you don't have a fever, you may be wrong. If you have a slightly elevated temperature and other symptoms of COVID-19, you should call your physician and ask him what he recommends. Other symptoms of COVID-19 infection include a cough, either dry and hacking or wet and productive, that just won't go away or is getting worse. Tiredness. Patients are reporting that they feel absolutely drained. If you are more fatigued than normal, or if normal activities absolutely wipe you out, especially if you have the other symptoms, you need to call your physician. As this disease progresses, people are becoming extremely short of breath. At this point, it is imperative that you call your physician and get directions as to what to do next. But remember, please don't just show up at your doctor's office or the emergency room. If you do have COVID-19, you need to stay away from other people so we can stop the spread of this disease. Call ahead and ask what to do. Do you know anyone who has had the COVID-19 virus? By this time, most people know of at least one person who has had this disease. Comment below if you know someone who has had COVID-19 and has already recovered. Because as we age, our immune systems can become less than efficient. Older adults are at greater risk if they contract this disease. Older adults and anyone who doesn't have a good reason for being out in the public should stay home even if your city has not ordered it yet. Self-quarantine is the best way to prevent the spread of this disease. While the death rate in the United States is about 2.2% overall, Those over the age of 60 increased to 3.5%. Those over the age of 70 increased to about 8%, and those over the age of 80 increased to 15%. And you are at increased risk of severe illness or death if you have other health issues such as cardiovascular disease, chronic obstructive pulmonary disease, hypertension, diabetes, or if you have a compromised immune system. If you are over the age of 60 and have no reason to leave home, stay put. You can get supplies such as food, household items, and your medications delivered by many grocery stores and pharmacies in your area. Ask your pharmacy if you can get a 90-day supply of your maintenance meds so that you don't have to get more frequent refills. If you do not live in the delivery area of your pharmacy, ask if they can mail your prescriptions. Whenever you bring anything into your home, whether mail, groceries, or your medications, remove the bags and discard them in the wastebasket. Then wash your hands thoroughly for 20 seconds and wipe down all items with an antiseptic wipe or a paper towel dampened with 60% alcohol. Also, disinfect any surfaces that have come into contact with items entering your home. Limit the number of visitors you allow into your home. If you have any of the medical conditions listed that increase your risk of complications, it might be best if you only visit with friends and family either over the telephone or over Skype. During this time of taking precautions, while you may need to physically isolate yourself, be sure that you don't socially isolate yourself. Call at least one friend or family member every day. It's important for you to keep in contact with them, even if you can't do so physically. Do you have an old friend that you haven't seen for a while? Call them up and catch up with them. Now would be a great time to catch up. Your grandkids are stuck at home and out of school. Call them up and tell them stories of your childhood. I'm sure they would love to hear how much fun you had as a child. Take this time to reconnect with the people that you haven't had time to contact recently. You've got a lot of time now. If you have an elderly parent, or if you are the elderly parent that has self-quarantined to avoid getting the COVID-19 virus, watch this video so you can get ideas on how to make isolation a little easier. If you have found this video helpful, please press that like button and consider subscribing to my channel. This is an unusual time in history and no one has had to deal with anything like this before. What are you doing to keep from going stir crazy that the rest of us might enjoy? Leave your comment below about what you're doing for fun while you're trying to stay healthy. Thank you for joining me today to learn about what older adults need to know about COVID-19. Stay healthy, wash your hands, and have a blessed week.